foundational level health literacy goal, right? All health providers should make sure that patients understand what it is they've been told. Next is to decrease the proportion of adults who report poor communication with their healthcare providers. So there are a number of national surveys, whether you're in a hospital system or see Medicare patients, or a bunch of other factors where adult patients share information, survey information on how they feel about communication with their healthcare providers. The next one has to do with patient participation. It's to increase the proportion of adults whose healthcare providers involve them in decisions as much as they wanted. So did the healthcare provider just say, here are the 3 things you're going to do? Or did the healthcare provider say, here are some options. Here are the pros and cons of the options. Which one of these do you think might fit best with your lifestyle? Or which of these do you think that you would be able to do? The fourth is to increase the proportion of people who say their online medical record is easy to understand. I laughed when I saw that. I find my online medical record to be impossible to understand. And we've got a long, long way to go, but finally, it's a national objective. One of them is, and this is an area where I do a lot of work with folks who have limited English proficiency, non-native English speakers, is to increase the proportion of adults with limited English proficiency who say that their providers explained things clearly. There are some national standards called culturally and linguistically appropriate standards, CLAS, that help define different things that organizations can do to help people who have limited English proficiency. And finally, because everybody needs a big goal, a BHAG, is to increase the health literacy of the population. So there we go back to the individual level to help individuals find, understand, and use health information. So in 2003, it was the last time that we nationally assessed health literacy for the United States. And it was actually through the National Assessment of Adult Literacy. There was a section that it was reading. So it was a section that assessed reading skills in the health literacy area and then application of some of those skills. These are some of the data that came from that. And what I think is most important to see on this schedule, on this graph, is the very top line where you'll see that it's only an average of 12% of people across this country who have proficient health literacy skills. Again, it doesn't matter about race, it doesn't matter about ethnicity. Generally, it doesn't matter about age, although we'll talk about that in a minute. Intermediate to below basic health literacy levels affect everyone. Now, we also do know, which is particularly important for this group, that low health literacy levels are associated with patients who are older, who may have limited education, lower income, chronic conditions. We know as people age, they tend to have developed chronic conditions and may have more than one chronic condition. And of course, for those who are non-native English speakers, because the language of healthcare is a third language for them. About 80 million adults in the United States are estimated to have limited or low health literacy. People with low health literacy are less likely to understand information, right, from their healthcare providers. They're less likely to adhere to medication and discharge instructions, which is really, really important. You know, as many medical, hospitals, I don't know about large clinics, but for sure hospitals, they have a lot of patients who get readmitted. And one of the reasons for being readmitted is that people don't adhere to their medication and discharge instructions. Well, certainly this could be because of behaviors, because of choice, because they couldn't afford the medication, but it also could be because they didn't understand what they were told. And I don't know if any of you have been in the hospital, but I have, and I've gotten those, 72 pages worth of discharge information. I am about as likely to read through those as I am to throw them in the trash can. And I can read and understand what they say. So imagine someone who has low reading skills. They'd be looking at a page with lines and squiggles all over it. And they would likely just try and remember what it was the person said to them. Patients with low health literacy are also less likely to keep scheduled appointments. Well, you might say, why? Everybody has a cell phone. Everybody keeps their calendars on their cell phones. Well, one of the things we know about adults with low literacy, which tend to be people who also have low health literacy, is that that's not what they use their cell phones for. Cell phones, whether they have internet access or not, for a low literate population, are generally used for text, photos, social network apps, app banking, right? They tend to do their banking on their phones. And of course, making phone calls. And that's it. They don't use all the apps and all the goodies and all the stuff that those of us who have higher literacy use to keep our lives organized and scheduled. As I said earlier, they're also less likely to seek preventive care. They're less likely to be able to manage their chronic health conditions. So imagine if you have 3 chronic health conditions and you have to see 3 different doctors and 3 different doctors' offices. And maybe those offices don't really talk to each other well. How are you supposed to be able to figure all this out and manage all of your health conditions? You may also not know that it's important to tell one doctor what's going on with the other doctor's office or what medications you're taking. So it's really a very, very important issue about health care, health behaviors, health outcomes that are driven by low health literacy. We also know that patients with low health literacy are likely to have low health knowledge, right? Low scientific knowledge. And frankly, I don't generally have low health literacy, but imagine if I broke my leg and I'd never broken my leg before, I would have super low health literacy about broken legs. We also know that they're likely to have poor health status, higher mortality, unnecessary emergency room use, and increased hospitalizations, increased revisits. So why really should we be concerned about this? Whoops. I'm gonna put up a YouTube video. It's about 3.5 minutes for you guys to see. Oh, hold on just a second. I think it just showed up here.
Grammarly does more than catch errors.
Hang on, sorry.
With Grammarly, you can find really good, perfect words that make your writing
Hang
sharp.
on, sorry, I apologize. I need to bring this screen in.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. And when they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them? Motrin or Tylenol. Normally Motrin, because that's what my doctor recommended. How old is your daughter?
She is 4.
She's 4. Okay. I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. 1 capsule.
1 capsule. I don't know what this is. Twice daily.
Okay. So how would you take this?
When I see it's not on, I tell you how to take it. It said take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe You have hypertension, and I've been taking care of that for a long time.
Hyper,
Mhm.
hyper.
Like you're hyper?
Mhm.
What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it
Okay,
being.
but you know you have high blood pressure.
Mm-hmm.
Okay, but hypertension doesn't mean the same to you.
Mm-hmm.
I have a small breakfast and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say one tablet twice daily, I don't know if they're talking take one in the morning, one in the evening, or take one in the afternoon or one in the evening. So usually what I do is take 2 of them in the morning. In this way, I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize, first thing you're gonna have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets, and I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign, never read it, and then a couple weeks later in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
Okay. I always gasp when I get to that last scene. And I've seen this many times. And think about the folks who are on this in this video. They're all real patients. They're faced with real literacy and health literacy challenges that we don't even know the kinds of challenges that people who have low literacy and low health literacy skills might have. Excuse me. So when it comes to a time like COVID, what do? How do we create health literate materials? How do we provide the right information in the right way for particular groups of people? Because a lot of understanding health information is really hyper local, right? It's like I may have a family myth about where disease comes from. We know that folks who come from Eastern-based religions and cultures may have a different sense of what health and wellness and illness are than folks who come from Western cultures. There might not be the same words in the same language, in different languages. Particularly when you think about Spanish, for example. There is actually a real case where the medicine label said take once a day, and the person who got the medicine was only a Spanish reader, and she read it as once, which in Spanish is 11. So she took 11 pills and she ended up in the emergency room. Fortunately, she was okay. But the things we need to think about as we start to create materials are things like who. Right now, as a researcher, these are the very first things that I think about. Who is this for? And then I might go and kind of ask some of my fellow researchers, well, is there really a need in this community? I might do a literature review. I might think about, calling colleagues or reaching out to colleagues in the communities, different communities, to find out what is it? What is it we're trying to say? Can we test those messages on people? Can we get focus groups together? We need to make sure that we're not testing messages with people for whom the message is not for, right? So I wouldn't test a message for limited English proficient folks who speak Swahili. I wouldn't test a message for that same message for them that I would for third-year college students at a private university. They're totally different messages, and they need to be delivered totally differently. So how do I know that? Why? Why are we doing this? Why are we trying to tell people this? Is there an action that we want them to take? Is it just something we want them to know? I like to use something called human-centered design in my research, which is an approach to answering these questions that it develops a solution to those questions or answers to those questions by involving the human perspective in all aspects of thinking about it. So it takes place in observing the problem, sharing the problem, brainstorming, conceptualizing, developing, iteratively developing, and then implementing the solution. That's how I work, with a lot of iterative development, going back to the source, making sure the who, what, why is right. And then COVID showed up, and none of that was possible. And not only was none of that possible, people needed to know immediately what to do, why to do it, how to do it. So what did we do? Well, I'm going to take a pause here and introduce my colleague, Dr. Michelle Hutchinson. And she's going to share with you some of the hows and some of the whats. And then I'll come back when she is done, and I'll show you some of the materials that we developed using those tools that are available at the CDC. So let me take a minute and introduce my friend Michelle. Dr. Michelle Hutchinson is the health literacy lead at the Centers for Disease Control and Prevention, the CDC. Prior to her current role, Michelle was a health communications specialist in CDC's Office of the Chief of Staff and the agency's Center for Global Health. She's worked with subject matter experts, researchers, policy analysts, and leadership across the CDC to make their materials resonate with various audiences, including not only folks who have low health literacy, but including members of Congress, public health partners, the media, and the public. Before coming to the CDC, Michelle ran her own communication and marketing company for 12 years, serving clients in a variety of industries, including those in public health, science, and medicine. She began her career as a dentist and later became an educator. Throughout all of those careers, Michelle has put an emphasis on providing information that patients, students, clients, and clients' clients can find, understand, and use. Michelle?
Thank you for that very nice introduction, Iris, and thank you all for choosing to spend part of your day with us. I am going to go ahead and share my screen now. Okay, and can you see the cover slide there? Karen or Iris, if one of you can let me know. I see your thumbs up, Iris. Thank you very much. Okay, great. So when Iris asked me to join this session, she asked me to share the resources and tools that we have at CDC that can help you create messages that make it easy. I'm tripping over my tongue here. Create materials that can help people easily find your main message, understand it, and use it. And our major tool is the CDC Clear Communication Index, and we call that the index for short. And the index is a field-tested, validated tool that is very helpful when you're developing new information or revising existing information. Now, the index requires you to have some plain language knowledge, and I don't know how many of you are familiar with the federal plain language guidelines. So I'm going to give you a few quick plain language lessons before we get into using the index. And when we usually teach use of plain language, the Clear Communication Index, and other CDC resources, we usually teach it as a 4-hour course. I only have an hour today. So that means 3 things: that I cut out a lot of content and a lot of interactivity, but we still will interact a bit. It also means that I'm going to ask you to share your questions until the end. I normally take questions throughout. And it also means I'm going to speak a lot more quickly than I normally do. So let's go ahead and jump right in. Here's the usual disclosure statement. I have no actual or potential conflict of interest in relation to this program or presentation. And by the end of today's presentation, you should be able to locate CDC's health literacy and clear communication resources and evaluate the clarity and usability of health information and messages. Now, before we get into those plain language lessons, we're going to play a little game. And we call this the Kiki Bobo game. There are 2 shapes up on your screen. One is called Kiki and the other is called Bobo. But I haven't told you which shape is which. So I'm going to put up a poll, and I'm going to ask you in the poll to tell me, by looking at these shapes, which one you think is named Kiki and which one you think is named Bobo. So let me go ahead and launch the poll here. And are you all seeing that, that question? And you can submit your answers there. And if the polling questions are hiding the images, you can drag that box, the polling box, to the right or left or to the side, wherever. I'll give you a few more seconds here. So far, about half of you have voted. Okay, in the interest of time, I'm going to go ahead and end the polling now and share the results with you. Okay, and you can see from the results that most of us thought that the image on the right was named Kiki and that the image on the left was named Bobo. And let me stop the results here so we can clear the screen for a second. Okay, and the research bears out that most of us would say that. And here's why. When we say the word Kiki to ourselves, we hear the k, the sharp sound of the letter K, and the shape on the right has sharp spiky points. In contrast, when we say Bobo to ourselves, we hear the sound of the letter B, ba, ba, and B has rounded edges just like the shape on the left. And I play this game with you to show you that our words can create images in people's minds. So when you're creating materials for your audiences, make sure that you choose the words that are going to create the intended images. Okay, so let's talk a little bit about plain language and health literacy. And I'm going to ask you another question now. This one you don't need to answer to me, just answer it to yourself. But when you hear the term plain language, what does that mean to you? And there actually is a formal definition for plain language. Plain language is communication that your audience can understand the first time they hear it or read it. At CDC, our measure of plain language is behavioral. We say a material is written in plain language if the intended audience can quickly find the information they need, easily understand it, and use it to make informed decisions. Plain language is also a tool that builds health literacy, and health literacy is a term that's been around for decades, and the definition has evolved over the years. And Iris covered the fact that during the release of Healthy People 2030, the U.S. Department of Health and Human Services, HHS, released new definitions of health literacy. And it was the first time that HHS ever included a definition for organizational health literacy. And this was important because it acknowledged that the blame for health literacy, and we should never blame I guess the responsibility for health literacy is not just limited to individuals, but that organizations who release information about health literacy also have an obligation to making that material understandable, usable, and easy for people to find. The point I want to make with this slide is that when we use plain language, we are making we're making our own organizations more health literate. So we're going to jump into that crash course in plain language. And our first plain language principle is know your audience. And Iris touched on that at the end of her presentation. You want to be specific about who your audience is. For example, are they immigrants? Are they older adults? Are they parents? Are they business owners? You know, all four of those audiences, you may want them to make the same behavioral change, but what they know about the topic, what their motivations are, their prior experience, their culture, both ethnic and social, and their proficiency with the English language will be quite different. And that brings us to our next point, which is to address separate audiences separately. So even if you want business people, older adults, and immigrants to make the same behavioral change, you're going to have to choose different words for them and even different communication channels. So it's really important to put yourself in each audience's shoes. It will give you a whole new perspective. Our next plain language guideline is to use logical organization. When you organize your material, when you logically organize your material, you make it easy for people to follow. And the best way to do that is to put the main message, the most important information, at the beginning of your material, and your background information or the least important information at the end. Now, if you have written articles for peer-reviewed published journals, you're probably more used to putting the background information at the beginning, like your literature search, and then you go to your research methods, then you talk about your results and conclusions. But when you're writing for the public, it's really important that the results and conclusion are presented first so that we can explain to the audience how to act upon those results. In fact, you might not even include the background information when you're writing for the public. And on the next two slides, I'm going to show you two examples of materials that put the main message at the beginning. This is a web page, CDC webpage about flu in people 65 years and older. And we put the main message right at the top of the webpage, and we emphasized it by surrounding it with this yellow box. The bottom line is the main message here is if you're over the age of 65, get a flu shot. Here's a fact sheet, a printed fact sheet, and I'm only showing you a snippet of it, but the top of it about the same topic. The main message is right here at the top. People 65 years and older need a flu shot. Notice that they emphasize this main message by using a larger font for it. And I really like the fact that the title of this fact sheet was information for adults 65 years older, but they didn't emphasize the title, they emphasized the main message, and that's really important. Our next plain language principle is use common everyday words, which means to use language that your intended audience is comfortable with and understands. If you have to use an unfamiliar term, define it the first time you use it. Now, here's a sentence where I think the average reader is not going to understand some terms: dermal exposure, hazardous agents, and systemic toxicity. So here's how we rewrote that sentence. We said harmful chemicals that touch your skin could poison other parts of your body. We changed dermal exposure to touch your skin. We changed hazardous agents to harmful chemicals. And we changed systemic toxicity to poison other parts of your body. I notice also that it wasn't just a simple matter of substituting one term for another, but we also had to recast the sentence so that the plain language terms make sense. You don't always have to recast a sentence. Sometimes it is just a simple substitution, but sometimes we do have to recast it. On the next slide, I'm going to give you a chance to practice with a little easier sentence here. And this sentence reads, if you live alone, maintain social ties with coworkers, friends, and family members. And I bolded the words maintain social ties because I felt maintain and social ties were terms that the average reader might not understand. So I'm going to ask you to type into the chat box what you would do to replace the words maintain social ties. And don't be shy because there's many good ways that you could revise this sentence. So just because one person chooses one way to revise a sentence doesn't mean you're wrong and they're right. There's many good ways to do it. So Karen says, be sure you call or contact. Alyssa says, keep in touch with, stay in touch with, see often. Great, great responses. And here's what our office came up with. We said, if you live alone, stay in touch with coworkers, friends, or family members. But all the ones that you came up with are equally good. The key is to use plain language. And we have a tool at CDC that can help you if you are looking for a substitute for a public health term. It's called Everyday Words for Public Health Communication. And it provides the public health term and its plain language substitute or recommendation. It also provides the original sentence that use the public health term. And then it also provides the plain language sentence with the revised sentence with the plain language term in it. So this is a really good tool, and we have the URL for that application for that tool up here, and we encourage you to use it. Our next plain language principle is to define acronyms and abbreviations, and an acronym is a capitalized term, is a series of capitalized letters that represents a multi-word term. And just like we said, if you have to use an unfamiliar term the first time to define it the first time you use it, the same thing applies to acronyms and abbreviations. And the way you define an acronym is by spelling it out the first time you use it, and then enclosing the acronym in parentheses right after you spell it out, as we did here in this example. So the National Safety Council, NSC, lists safety observances and events on its website. If you only use the term once in your material, then just spell it out and you don't even have to define the acronym at all. Now, while we give you this recommendation to define acronyms and abbreviations, we also recommend that you minimize the use of acronyms and abbreviations, because forcing your readers to remember what they mean taxes their memory, and that takes their focus away from the rest of your content. And we don't want to distract our readers. And the last plain language guideline that we'll cover today is use active voice. And active voice is the #1 plain language guideline that will change the tone of your writing. What do we mean by active voice? Well, in an active voice sentence, a subject, a person, place, or thing does something, performs an action. And verbs are action words. In contrast, in a passive voice sentence, the subject has an action performed upon it. So let's look at 2 sentences to see what we mean by this. In our first sentence, the company polluted the lake. That's an active voice sentence. The company is the subject of the sentence and the action is polluted. Now, in the second sentence, the lake was polluted by the company. You might think that the lake is the subject of the sentence, but the lake isn't doing anything. The lake isn't doing the polluting. The lake is being passive. It's having the action of polluting done upon it. This is a passive voice sentence. Let's look at how you can identify passive voice sentences in your own writing, or if you're reviewing someone else's material, so that you can revise them. So here's our passive voice sentence. The lake was polluted by the company. Passive voice sentences will almost always have a helping verb in them. And helping verbs are forms of the verbs to be or to have. So is, are, was, and were are forms of the verb to be. Has and had are forms of the verb to have, and has been and had been are forms of both verbs. So in our sentence, we see the word was, which is a form of the verb to be. Also, passive voice sentences will almost always have a past participle in them. And in our sentence, polluted was the past participle. Now, I don't want you to confuse past participle with the past tense form of a verb, even though they're the same words. For example, in our active voice sentence down here, polluted was the verb. It's a past tense verb. But in our passive voice sentence, polluted is a past participle. Past participles always need a helping verb. And in our sentence, it has the helping verb was in front of it. If you take the helping verb out of a sentence, a passive voice sentence, the sentence doesn't make sense. To say the lake polluted by the company doesn't make sense. Active voice sentences are some of the simplest sentences that you can write, and they always take the form of subject, verb, object, as in our active voice sentence, the company polluted the lake. Now, there's another problem with passive voice sentences. They can often leave the reader wondering who performed the action. So here we have a passive voice sentence that reads partnerships were increased. But we don't know who increased the partnerships. There's no subject in this sentence. So we rewrote that as we increased partnerships. Now we know who performed the action. Now we know who did the increasing. So with that crash course in plain language, we're going to jump into the CDC Clear Communication Index, which I said is called the index for short, and is an excellent tool for revising existing material or creating new material. And the CDC index has a CDC Clear Communication Index has a cover sheet with 4 open-ended, unscored questions. And then it has 20 scored questions. Those are yes, no questions that are divided into 4 sections. And you can find the CDC Clear Communication Index at the webpage with this URL. And in addition to having the PDF version that Karen sent to you with the link for this session, we also have a digital version of the Clear Communication Index. Both the PDF and the digital version will calculate the score for you, but we'll talk a little bit more about scoring in a little bit. Let's first talk about the details of the Clear Communication Index. So let's start with the cover sheet. And as we said, it has 4 open-ended, unscored questions. But it's really important to spend a lot of time answering these questions because many of them are tied to the scored questions on the index. And answering the questions on the cover sheet will help you frame your message appropriately for your intended audience. So let's look at each of these questions individually. And the first question is, who is your primary audience? And as I said earlier, when we talked about plain language, you want to be specific about who your audience is. And as Iris said again, you also, you need to identify who your audience is. It's not everyone. If you're trying to reach everyone, you're going to end up reaching nobody. So here are some examples of very specific, being specific about who your primary audience is. If you're writing for people over the age of 80 and they have questions about vaccine safety, then it's people over the age of 80 with questions about vaccine safety. Maybe you're creating some material for one of your partner organizations. So in that case, partner organizations looking for evidence-based programs to increase exercise among adults over the age of 65 in their communities is a very specific primary audience. The second question is, what do you know about the health literacy skills of your audience? And sometimes you can get that answer by doing a literature search on your intended audience. Perhaps you can get that information if you work with a partner organization who works with that audience, and they may know the answer to that question. If you don't know the answer to that question, then just assume low to average health literacy skills. And Iris went over with you what the different levels of health literacy skills are. But in the slide deck that we provide here in the notes section, we also provide a link to the study that talks about the different health literacy skills. The third question asks, what is your primary communication objective? Your communication objective is what you want your audience to think, feel, or do after they read your material. It's not what you're doing, it's what you want your audience to think, feel, or do. So you may be providing information about Outbreak X, but if you're, let's say you're sending out a press release about Outbreak X, so obviously it's going to the media, then maybe your communication objective is to have media outlets write more stories about Outbreak X that include accurate information. So your communication objective could be to increase the number of major news outlets that share accurate information about Outbreak X. If you're writing for a particular public audience, maybe you want to, you're telling more people about disease Y, but your communication objective would be perhaps to increase the percentage of older adults who get screened for disease Y. And then the fourth question on the cover sheet is, what is your main message? The main message is the one thing that your audience must remember. It's usually about 1 to 3 short sentences. So something like what you should know about disease Y is a title. It's not a main message, but it could be a good title for a material whose main message could be, you could have disease Z and not feel sick. This means you could pass disease Z to others and not know it. If you've been exposed to someone who has disease Z, get a Z test to find out if you have the disease. 1 to 3 sentences, main message. So now we're going to get into the scored sections of the index. And as I said, it has 20 scored questions, yes, no questions, divided into 4 sections. We will only have time today to cover the core, part A and part B. We call part A the core of the index because no matter what type of material you are scoring, you will always use part A. You may not use part B, which deals with behavioral recommendations. You might not use C, which deals with numbers, and you might not use part D, which deals with risk, if none of that material is included in your information. Part A deals with how well we cover the main message and call to action, and I'll define call to action shortly. It deals with the language in the material. Is it understandable and is it appropriate for the intended audience? It deals with information design, meaning do we make it easy for people to find the information? And it also deals with the state of the science, which means what we know and don't know about the topic that we're covering. So let's take a look at the questions on part A. And if you printed the PDF that Karen sent you, this would be a really good time to pull that out and have it handy as we go through the various questions. So part A has 11 core questions. And the first question is the most important question on the index. If you answer, and we'll go through it in a minute, but if you answer no to question 1, you have to answer no to questions 2 through 4, question 6, and question 10, and you'll see why in a moment. So question 1 says, does the material contain one main message? And if you look at the subtext, it says, if the material contains several main messages and no main message, answer no. And it's really important to have one main message, because if you overload the readers or your listeners with too much information, they're not going to remember anything. So question 2 asks, is the main message at the top, beginning, or front of the material? Well, if you answered no to question 1, you have to answer no to question 2, because if you don't have a main message, then it can't be at the top, front, or beginning of your material. Question 3 says, is the main message emphasized with visual cues? A visual cue is a difference in font, color, shape, or the use of lines or arrows or headings to emphasize your main message. Well, if you don't have a main message, you answered no to question 1, you have to answer no to question 3. Question 4 asks, does the material contain at least one visual that conveys or supports the main message? And a visual is a photograph, a line drawing, a graph, or an infographic. But note in the subtext that if the visual doesn't have a caption or labels, then you have to answer no. If the visual has humans who aren't performing the recommended behavior, you also have to answer no. And just like I said before, if you answered no to question 1, you have to answer no to question 4, because if you don't have a main message, then you can't, no matter what visuals you have, it's not supporting a main message. Question 5 asks, does the material include one or more calls to action for the primary audience? Call to action is what you want your audience to do after reading or listening to your material. Sounds a lot like the communication objective we talked about on the cover page. So look at the subtext here. If the call to action is for someone other than the primary audience, answer no. On the next slide, I'm going to just give you some examples of calls to action. As I said, it's what you want your primary audience to do after reading or listening to your information. And it could be something as simple as directing the reader or listener to a web page where they can find more information. We call that a weak call to action, but it's a call to action nonetheless. The other items on this page are much stronger calls to action, something like talking to or asking questions of your health provider or a public health professional. The next page has some more examples of calls to action, like following a recommendation, making a health behavior change, or supporting or making a health behavior change. These last 4 calls to actions are more appropriate calls to actions for policymaking audiences, such as public health departments or partner organizations. For example, you're not going to ask a member of the public to fund research or programs about a topic unless your audience is somebody like Bill Gates. And on this slide, I wanted to show you the difference between a visual cue and a visual because they sound the same, and I don't want you to be confused about the difference between them. Remember that we said a visual cue is something that supports your main message. And on this web page, and I'm just showing you the top here, but on this web page, the main message is emphasized in bold font. And then a visual cue is a photo, an image, a line drawing, a graph, or an infographic that supports or conveys your main message. And on this web page, we used a photo, and we show this child washing his hands, which is talked about in the main message, and we provide an appropriate caption for it as well. Remember, if you don't have a caption, then you have to answer no to the question. Or if you don't have caption or labels, you have to answer no to the question about visuals. Questions 6 through 11 are shown on this slide here. 6 through 7 are the language questions. 6 asks, do both the main message and the call to action use active voice? Well, if you answered no to question 1, which is asked if you had a main message, then you have to answer no here. Similarly, if you don't have a call to action in your material, you also have to answer no to question 6. Now, if you have a main message and a call to action, but one or both of them does not use active voice, then you also have to answer no. And that's why I went over active voice with you before we got to the Clear Communication Index. Question 7 says, does the material always use the primary use words the primary audience uses? We talked about our tool using everyday words for public health communication. We also talked about the importance of defining acronyms and abbreviations the first time you use them. Questions 8 through 10 deal with the information design, meaning how easy is it for your primary audience to find the information. Using bulleted lists is a really great way for people to find information because a lot of people just scan material the first time they look at it. But notice that if your bulleted list has more than 7 items, then you have to answer no, because more than 7 items is too much for people to remember. And if the list is only for additional information or references, then you also have to answer no. 9 asks, is the material organized into chunks with headings? Nobody wants to see a wall of words. Breaking information up into chunks and having each chunk of information preceded with a relevant heading also makes your information easier to read, makes it easier for people to find the main message. So if you don't use chunks with headings, then you would answer no. 10 asks, is the most important information the primary audience needs summarized in the first paragraph? That goes back to the plain language principle about logical organization. And the most important information must include the main message. Well, if you don't have a main message, if you answered no to question 1, then you have to answer no to question 10 as well. And question 11 asks, does the material explain what authoritative sources such as subject matter experts and agency spokespersons know and don't know about the topic? And, you know, we're really good at telling people what we know. Sometimes public health, people in the public health community aren't so good about telling people what we don't know. And it's really important that we tell people what we don't know, because we're being transparent when we do that. And when we're transparent, people trust us more. And when people trust the messenger more, then they're more likely to follow the recommendations that we provide. So on this slide and the next slide, I show you examples of how to address the state of the science, particularly with respect to what we don't know. This comes from a webpage for parents about vaccine safety. And it has a sentence that reads, although scientists identify most common side effects of a vaccine in studies before the vaccine is licensed, they may not detect rare adverse events in these studies. So it tells people we may not know every single adverse event, but we go on to say what we're doing to find the answers. We say that therefore the US vaccine safety system continuously monitors for possible side effects after the FDA licenses a vaccine. So saying what we don't know could be as simple as this one sentence, or it could be a little bit more involved, as we did on this webpage about Zika virus. At the top, we talked about what we know about Zika virus, and at the bottom, we provided 3 bullets about what we don't know about Zika virus. So now we're going to move on to part B of the index, which has 3 scored items on behavioral recommendations. If your material does not have any behavioral recommendations in it, don't use part B and you won't lose any points. First, let's talk about what we mean by a behavioral recommendation. A behavioral recommendation is a suggestion to start or stop a behavior. Examples are things like beginning a health behavior, stopping a harmful health behavior, maintaining a positive health behavior, or following a health or safety practice. And all behavioral recommendations are calls to action, but not every call to action is a behavioral recommendation. For example, telling people where they can go to find more information about a topic is not a behavioral recommendation. It is a call to action. And your materials can have more than one call to action. They can have more than one behavioral recommendation, but they should only have one main message. And your call to action and your behavioral recommendation do not have to be in the main message. They can come later in the material. So now let's move on to part B. And when you get to part B, there's an introductory question at the top that says, does the material include one or more behavioral recommendations for the primary audience? If you say yes, then you go on to questions 12 through 14. And question 12 just asks you to confirm your response to this introductory question. Question 13 says, does the material explain why the behavioral recommendation is important to the primary audience? And we want to tell the readers or the listeners why it's important, because people are more apt to follow our recommendations if we tell them why it's important to them. Then 14 asks, does the behavioral recommendation include specific directions about how to perform the behavior? This is equally important because people are more likely to follow our recommendations if we tell them how to do it. And the same applies to when you get to parts C and D of the index. There'll be an introductory question asking you if this section applies. And if it doesn't, you just move on and you skip that section and you don't lose any points. Okay, so now we're going to do practice scoring and do some group practice. But let me first mention how the index calculates the score. You can calculate the score manually if you want. You add up the total points that the material earned, and you also add up the total possible points that the material could have earned. Step 1 is your numerator, step 2 is your denominator. You divide numerator by denominator, you multiply by 100, and you get a percent, and that's your score. And we say that a score above 90% is 90% or above is excellent. If your score is below 90%, we recommend that you go back to all the items that scored 0 points. You also consult the user guide, which is on the Clear Communication Index webpage. And that will also give you advice on how you can revise your sentences and improve your material. And then use the index again to rescore the material, and use the index as many times as needed. Revise your material as many times as needed so that you can get the material to score 90% or above. So we are going to score a CDC webpage about when and how to wear cloth face masks. And as Murphy's Law would have it, I would, of course, choose a page about masks when just yesterday CDC released new guidance about wearing masks. But nevertheless, this is good. This is still a good example for us to use. And this link was sent to you with the link for today's session. But if you were a last minute registrant, you might not have had time to take a look at this webpage. So take 2 minutes now to do that. And while you're doing that, I'm going to bring up the webpage and the Clear Communication Index. And Karen, can you copy and paste this link into the chat box so that if
Yep, I'll do that.
somebody doesn't have it handy? Okay, thank you so much. All right, so I'm going to stop sharing this slide deck, and I'm going to bring up the index and the webpage.
Oops, that didn't work. Let me get the right one in there.
Okay, you have about 1 more minute. I know it's not a lot of time, but it's, I mean, if you just can scan the page rather than read it in detail, that's fine. And let me share my screen again with you. You have about 20 more seconds. Okay, I just put the link in the chat. Karen, I don't know if you were able to. And Karen, can you also tell me, can you see the split screen now? You might be muted. Or can somebody
Yes.
tell me?
So
Okay,
I can see the.
okay,
Yeah,
great.
you
Okay,
can see it.
perfect.
I apologize.
Okay.
I sent a direct message.
Don't
and
worry,
sent it to everyone.
not a problem, not a problem. Okay, so on the left side of the screen, I brought up the digital version of the CDC Clear Communication Index. On the right, I brought up the page that we're going to score. And the first question asks the name of the material. So I'm just going to copy and paste from the right into the left. And there we have it. Now I want to show you something on the digital version of the index. The second question is material type. And since we're scoring a web page, we're going to choose print and web, but there is this drop-down menu where you can choose things like Facebook post, a written script, an infographic, or a short message like a tweet. And this is really good to have these options because some of the 20 questions on the index don't apply to these shorter materials. Also, if you were maybe scoring a landing web page that doesn't have very much text on it, but mostly has widgets, you might want to choose one of the shorter options like a Facebook or a written script, because these give you fewer questions. And like I said, some of the questions on the index might not apply to shorter materials. And we go on to the next screen. And it asks, who is your primary audience? Be as specific as possible. Again, you have a drop-down menu from which you can choose, but the last option is other. And we'll choose other. If you choose other, then you have to specify who your primary audience is. And I would say that for this webpage, our primary audience is probably people with questions about about when and how to wear a cloth mask. And we'll move on to, we're on the cover sheet now. So that was the first question on the cover sheet. And we'll move on to the second question is, what do you know about the health literacy skills of your audience? And remember, we said if you can't find out anything about them, we're going to assume low to average. So that's what we'll do here. Okay, what is your primary communication objective? And remember, this is question 3 on the cover sheet. A communication objective is what you want your audience to think, feel, or do after they receive the message or material. And when I read this webpage, I felt that the communication objective was to increase the number or percentage of people who wear a cloth mask correctly to prevent the spread of COVID-19. Okay. And then what is your main message? What is the main message statement in the material? Now this is interesting. When I read this page, I wasn't sure, is this the main message or is, whoops, and I didn't mean to click on that link. So let me go back on that. And let's see if it will let me, if I can, oh, right. Let me, it's, my control panel is preventing me from going backwards. Let me slide this over so I can go back. Okay. Now we can bring this back. There we go. Okay, so I wasn't sure if this was the main message or if this was the main message. When I read both, I felt that the top was the main message, but I did ask myself, if this is the main message, why didn't they put the blue box around this? But we'll get to that in a moment. So I felt this was the main message. We could copy and paste it if we'd like. The other option, I felt like the bottom line on this main message is wear a mask. So if you just wanted to type wear a mask correctly in here, that would be fine too. So now we're going to go on to part A. We're going on to the scored questions. And the first question asks, does the material contain one main message? And when I read this webpage, I felt that it did. So I would answer yes. And notice that if you're ever unsure about a question, you can click on show example. The digital version will show you different examples. The user guide will also show you examples. What I might do, notice that the index also has a section for entering notes. So if I were scoring someone else's material, I might put something in here to say, recommend moving blue box to first paragraph. Okay, is the main message at the top, beginning, or front of the material? Well, it most certainly is. Whether we think this is the main message or we think this is the main message, it's certainly at the top, beginning, or front. So we'll say yes to question 2. Question 3, is the main message emphasized with visual cues? And remember, the visual cue is something that emphasizes your main message with font, color, shape, line, arrows, or headings. And since we said that this first paragraph was our main message, we're going to have to answer no, because this main message, this first paragraph, isn't differentiated from the rest of the material on the web page. And that's why, again, you could say answered no because main message not emphasized with blue box. Move blue box to first paragraph. right? And then does the material contain at least one visual that conveys or supports the main message? There are some great visuals on this page, right there, right there, right there, all throughout. But remember, if the visual doesn't have captions or labels, you have to answer no. And I don't see captions on these images. Maybe these arrows are meant to be labels. And, if so, then maybe you would answer yes for this. But people with low literacy skills or people who have intellectual disabilities might not know what these arrows and check marks and X's mean. So I would answer no to this question. And I might put a note to say, add captions to the images. That would make it very easy to answer yes for this. In the interest of time, I'm not going to type it, but just know you could put that note there. Does the material include one or more calls to action for the primary audience? It most certainly does. All throughout, call to action, wear your mask correctly. It talks about staying 6 feet apart. So, and even at the bottom, it tells readers where to go to get more information. Now that's a weak call to action. There's much stronger calls to action throughout. So we're going to answer yes to this. Does the main message and the call to action use active voice? Now, if this is our main message, I would say yes, it does use active voice. And we agreed, well, I agreed because you didn't get a chance to chime in, which you would have done if we had 4 hours for this course. If we say this is the main message, then it does use active voice. If you thought this was the main message, then I would say no, it doesn't use active voice because the second and fourth bullets don't use active voice. Masks should be worn as passive voice. Masks are required is also passive voice. But since we're going to say this is our main message, then we're going to say yes to this question. Question 7, does the material always use words the primary audience uses? For the most part, I think it does, but there are some words on here that I think might not be understandable. Transmission is a word that a lot of people don't understand. I think that you can, rewrite this by using to avoid spreading the disease to others. Precautions was another word I caught on here that a lot of people might not understand. So I would say no to question 7. Does the material use bulleted or numbered lists? And it most certainly does. You see those throughout. And none of them are more than 7 items. The longest bulleted list on here is 6 items. So I would say yes to question 8. Is the material organized in chunks with headings? And again, they did a very good job with that. They have clear headings throughout and they follow the headings with their bulleted list. So we're going to say yes to question 9. Is the most important information the primary audience needs summarized in the first paragraph or section? And it is how to wear a mask, wear your mask correctly. So we'll say yes here. And does the material explain what authoritative sources know and don't know about the topic? They did a great job of saying what we do know. I did not say anything saying what we don't know about this topic. So I would say no. And if you could say to me, well, how would you add something to this page about what we don't know? Well, maybe you could add information about that we're still investigating how cloth gaiters work or how facial shields work. But, you don't have to answer, you don't have to get a point on every question to get a 90% or above. So if you answered yes to all the questions except this one, you would get a 90% or better on this material. So now we've answered all the questions on part A. It gives us our score on part A, is 63%. It shows us how we answered each of the questions. And now we're going to move on to part B, which is behavioral recommendations. We have our introductory question that asks, does the material include one or more behavioral recommendations for the primary audience? And it does. I mean, wear a mask right there is a behavioral recommendation. So we're going to say yes. And then question 12 asks us to confirm that we wanted to say yes to that introductory question. So it defaults to yes. You would change it to no if you made a mistake, but we're going to stick with yes. Does the material explain why the behavioral recommendation is important to the primary audience? And it does. You wear a mask to prevent getting and spreading COVID-19. Did a very good job of that. And does the behavioral recommendation include specific directions about how to perform the behavior? And it does, you know, start by washing your hands or using hand sanitizer, put it over your nose, mouth, and chin, make sure it fits snugly. So we're going to answer yes to that. Okay. So now we have scored all the parts of part B. We got 100% on part B. We're going to move on to part C in the digital version, and there's nothing about numbers in here. So we're going to say no to the introductory question, and that's going to allow us to skip to part D. There was nothing about risk in here. So we're going to say no to that. And that's going to take us to the score for the material. So we scored 71%. So what we would do is we would go back to all the questions on which we scored a 0, and we would revise the material so that we could answer yes to more of the questions. And all the things we got to know on are very, very easy to fix. The only one that might not be easy to fix is the one about what we don't know about the topic. And like I said, if that's the only question on which you answer no, you would get a 90% or better on this material. So we do have some other materials and resources and tools that you can use. So I'm going to stop this share and I'm going to go back to my slide deck. So give me a moment while I do that. Okay, let me reshare my slide deck. Okay, are you seeing the slide that says more CDC resources? Somebody can just give me a yes or no.
Yes.
Okay, thank you. So we mentioned that we have everyday words for public health communication. Well, CDC's National Center for Environmental Health and Agency for Toxic Substances and Disease Registry also has an environmental health thesaurus, which works very much like everyday words. If you're writing about an environmental health topic and looking for a plain language substitute for an environmental health term, you can use this resource. Just like with everyday words, it will show you the original sentence using the environmental health term, and it will show you the revised sentence using the plain language term. We also have a health literacy website, which has excellent information about health literacy research, practice, and evaluation. And you can also subscribe to our weekly health literacy update. We have free online health literacy courses you can take, and the URL at the bottom of this slide will take you to the webpage that lists our health literacy courses. And since I am talking to or speaking to a gerontology institute today, I thought it would be very helpful for you to know that CDC has COVID-19 materials that are specifically intended for this audience. And all of these materials are hyperlinked on the slide, but in the notes to the slide, I also provide the URLs in case the hyperlinks don't work for some reason. And we have about 9.5 minutes for questions here, or would you prefer, Iris, that I turn it back over to you and have us save all the questions until the end?
Now let's go ahead and take some questions now for you, Michelle. That was a great presentation.
Thank you. I appreciate the compliment. So I am trying to access the chat box right now to see what the questions
we have
are.
one question that's in there right now.
Okay.
And
Go
it was from Jamie, and it says, if wear a mask is a behavioral recommendation and stay 6 feet apart is a call to action, what's the difference between behavioral recommendations and call to action?
Okay, so I would say that stay 6 feet apart is also a behavioral recommendation. A behavioral recommendation is anything that asks people to change a behavior or maintain a behavior that is already healthy. All behavioral recommendations are calls to action, but not all calls to action are behavioral recommendations. So for example, a call to action that is not a behavioral recommendation would be telling people to go to a specific web page to find more information. That is a call to action, but is not a behavioral recommendation. Does that help clarify that for you, Jamie? And again, for some reason, I can't see if Jamie put a response in the chat box, I can't see it.
Yes, she says it does. Thank you.
Okay. Are there any other questions?
One question that I had, and then hopefully other folks will type in as well. A lot of the information that you're talking about there that you can pick what the level of your audience is. And can you talk about when you would pick, because I would normally say I would pick low to average every time just to be sure for universal precaution. But when would you use above that?
If I were speaking or writing something for a group of physicians, I would probably choose a higher level of health literacy. If I were writing something for epidemiologists, I would probably choose a higher level of health literacy. Does those examples help drive home the answer to that question?
Yeah, and I think that to me also then brings up the point that it's important to use different pieces for different audiences, because a lot of times people like to just create one piece and then disseminate that to everyone. So yeah, I wanted to hear a little bit about, you know, it's not uncommon to have multiple pieces for one topic.
Correct. And that goes back to the points that both Iris and I made about knowing your audience, creating separate messages for separate audiences. And also you're going to have to use different communication channels for different audiences. Studies show, for example, that immigrant populations often use the radio to get their information. So, you know, if you have a message for an immigrant population, then you probably want to use radio to get that message out to them. You know, younger people tend to use social media. So we would probably put those messages for that audience on social media. And Iris also talked about testing your messages with intended audiences. That's very important. You know, ideally you want to test it before you release it to make sure that the intended audience can find the information they need, understand it, and use it to make appropriate health-related decisions.
Mike, if you want to unmute yourself, feel free to ask your question, or can you see the chat now, Michelle? Or would you like
no, I don't know why for some reason, you know, I was able to see it earlier.
Okay.
And for some reason I can't see it now.
Karen, do you want me to ask the question?
Sure, that'd be great, Mike.
Hi, Michelle. Thank you very much for this superb presentation.
Well, thank you. Thanks for being here.
I'm hopefully going to be doing some work with people in a community, in a large city, community health champions, we're calling them. And they are people from the communities that they live amongst. And we're hopefully going to be working with them to share messages about initially COVID, but then broader health subjects. And I just think this tool looks fantastic, but I'm just wondering, have you seen it used by people who may have low health literacy levels themselves? Because I think it would be great,
so,
but it looks a bit complicated, that's all.
Okay, so you're going to be, so if I heard you correctly, you're going to be creating messages that the community champions can take to the larger audience. Is that correct?
Yes, exactly.
Or is it, okay, so if the champions have low health literacy, you definitely want to test your messages with the champions before they bring those messages forward to the larger community.
Yeah.
And so, first thing you might want to do is you and your teammates at whatever organization you're with would want to use the Clear Communication Index on your material, or you could work backwards. You could use all the principles in the Clear Communication Index to try to create a material that's as clear as possible, score it, and then test it with the community champions to see if they can find, understand, and use the information.
Yeah, thank you.
You're
What
welcome.
I'm thinking as well is one of the principles I always use with health literacy is let the people who the communication is intended for write it themselves, rather than try and be a clever professional like I might be. So I've just wanted to see if we could actually get the community health champions just using that tool.
I don't know if the tool itself has been tested with people with low health literacy. When it was field tested and validated, it was tested with users, meaning people who generally create the material. So it was tested with subject matter experts. It was tested with health communicators. Then we also tested it in the field with people who would be evaluating, with people who would be reading the material. In other words, we created material that used the index and material that didn't use the index. And we tested it with the intended audiences. And the intended audiences told us that it was much easier for them to find the main message and understand it in the material that was created with the Clear Communication Index. Now, I applaud you for working with the champions in the community to create the material, because they're going to know better than anybody the language that's going to resonate with the intended audience. But I think even after they create the material, you might want to use the index to make sure that it incorporates all these principles.
Okay, that's great. Thank you, Michelle.
You're welcome. Any other questions, Karen?
I don't see any at this time in the chat.
Okay, I'm going to stop sharing my screen. And by the way, if you need to reach me, you can send an email to healthliteracy@cdc.gov. That will get to our health literacy team. And if it's intended for me, they'll forward the message to me. So thank you so much for being a great audience. And I'm going to stop sharing and turn this back over to Iris now. Iris, the floor is yours.
Thanks, Michelle. Thank you, everybody, for participating in Michelle's great activities. It's really interesting that the things that you don't even think about, that after you have such a great presentation from someone like Michelle, that it's all kind of common sense. And it's really wonderful to have these great tools that are put together, that are validated, to be able to use in your work. So what I wanted to do now is to show you the the non-research based activities that we undertook as COVID hit the ground. Now, I say, non-research based because they weren't done with human-centered design or with participatory based research, which is usually the way that I do my research. Instead, we used other tools like the CDC's index to assess where we were, what we needed, and how to go forward. So I am going to share my screen with you. Okay, here we go. I'm going to start with the very, very first thing we did as materials were being written about the coronavirus and COVID. It dawned on me that there was very little that was written for adults with low literacy skills, or at least I thought that there was a need for that. So this is my research center, the Adult Literacy Research Center at Georgia State. And the very first thing we did was we said, okay, let's take a look at all of the COVID-19 materials we can find out there. And then let's measure them according to readability, usability, and see if we can't identify the ones that are particularly appropriate for adults with low literacy. So you'll see that we used something called the Visible Thread Readability Software, which is a software that it's wonderful because it doesn't only look at readability of words, but it looks at the entire presentation that you've got. So for example, you can throw a PDF into the Visible Thread readability software tool, and it gives you back a readability score. It also tells you what's good, what's bad, what you need to change, what are passive sentences, etc. There is a cost to using the software. It is the software, I believe, that the CDC uses, but I know that several other government agencies use it. Michelle introduced it to me at the very, very beginning of COVID. Michelle, does the CDC use the Visible Thread readability software?
Yes, we do. It's not used across the agency. There's only a few divisions and offices within it. Our office uses it. We're trying to get it more widely used across the agency. And no software is going to be as good as a friendly, experienced editor. The software is not perfect, but it really is good. It's going to point out passive voice, hidden verbs, which we didn't get a chance to cover, but a lot of the other plain language principles. And I'm sorry to taking away from your time here, but I'm gonna put a URL in the chat box for folks to go to that has all the plain language principles, so they can get that information.
Great, thank you, Michelle. I appreciate that very much. So we took all of the materials that we could find, and we loaded them into the software, which again, we know is not perfect. One of the really important things actually that you need to understand and know about readability is that there are many different tools to use that, and of those many different tools, you may get a range from, grade 2.3, grade reading level 2.3, grade to grade, reading level, 4.5. So how do we decide how to separate and source this information for people? So what we decided to do, and this is something that we've done in our Center for the Study of Adult Literacy as well, is to categorize these materials into easier and harder. Easier is 5th grade and below, harder is 6th grade to 8th grade. And that's where we stopped. So these materials, I'm sorry, 6th grade to 9th grade. These materials are really for people who work with, let me say that again, this library has materials that are for people who work with adults with low literacy. I wouldn't expect someone with low literacy to pop onto this website and go, oh, okay, I'm going to look for easier materials and, to really understand what we did. But if you're an adult educator, or if you're a health educator, or if you're responsible for getting messaging out to folks who have low literacy skills, here's a great way to do it. So we created this library, and as you can see, let's just pop this one up here. This was, oh, come on, computer. I love coming on here and seeing how many people have been here to use the tools. So I'm going to download that, and hopefully it'll just take a second and it'll pop up. There we go. So you can see what that is. So this is a very simple tool that we basically just measured readability for. This was at the very beginning. We were like in a real panic, and we were trying to create materials and find materials for folks with low literacy. Oh, sorry, let me go back to my research center. So that's one thing that we did. One thing that we did was we created a library for folks to use. Okay, then this is another research center that I'm involved in. It's the Prevention Research Center, and we work in the refugee community. Sorry, hold on just a second. Okay, can you guys hear me okay? Yes, okay.
Yes.
So in the refugee community, we found that there were a number of myths that really were complicating how to get messaging out to the refugee and immigrant community about COVID. Again, we could not go back to a group of people to do focus groups. We couldn't, ask them, is this the right color? Is this the right size? Are these the right words? And so we worked with our partners our clinical partners in the community, and a community-wide task force made up of people who provide services and service organizations to the refugee community. And we created this flip book. We had imagined that it was going to be like, I don't know if any of you besides me are old enough to remember when you would have actually printed photographs and you'd put them in a book and the pages would flip and you'd get to see all of your pictures. So that was kind of the concept. As you can see, we did go back to measure these against the CDC index. We measured each page as a separate item. Some of the pages we got rid of, some of them we kept, but this is what we prepared. Now, you may look at this and say, oh, but that's in English. Do all of your refugees and immigrants speak English? And the answer is no. We started with the English version to make sure we got it right. And then we had it translated into 7 different languages that were the most common languages for the community. So instead of using words like, this is a myth, this is a fact, we said, this is what I heard, right? So if I'm a person and I'm reading this, oh yeah, I heard that too, right? So there's a bit of empathy and connection to the words. And then we put some facts about very simple sentences, but facts about coronavirus. What I wanted to show you on the next few pages is that these are some of the other myths we heard. Black people cannot get it. God will protect you. Let me, for a minute, stop on this page with God will protect you and talk for a minute about messaging. So the worst thing you want to do when you're creating a health literate message for someone is to say to them, what are you, crazy? Or no, you're wrong. Or, how can you believe that, right? You don't want to do that. You need to acknowledge someone's feelings and family myths and cultural myths. So what we decided to do on this God will protect you page is we just decided to sort of ignore the question and to just say that doctors and medicine can treat coronavirus, not God won't protect you from getting coronavirus, right? So that's also something very important to think about. You may notice on many of these pages, we have repeats, right? Repeats are very important for folks who have low literacy, low health literacy. I heard young people can't get it. Anyone can get coronavirus. Many have died. People who come from a hot country can get it. Oh, look, here's the same answer. Anyone can get coronavirus. Many people have died, right? So as we, the first half of this book was about myths. And then we moved into actions and behaviors and behavioral intentions. And again, these are questions that were coming to us from the healthcare providers and community or organizations in the community. How can I help myself and others not get sick? Okay, very simple pictures. And here are the actions. Wash your hands, do not touch, stay at least, stay at home, all very active oriented, telling people what they should do. We thought long and hard about, is it important for folks to understand what this disease is, where it came from, how does it transmit from person to person? And we decided no. We decided that the most important thing that folks needed to know was what to do. And that's what this flip book is about. One of the big issues in the immigrant and refugee community is not having people, not having people over, not being hospitable. And so we addressed this in this way. And as I said, these are available in multiple languages. This was a really important one. You know, folks who are frontline workers did not have the opportunity to do what many of us did, which is stay home and do our work on a computer or by Zoom or however we did it. So it was really important for them to understand what to do when they get home from work, right? And so we gave them instructions about when you travel to work and you travel home, and then also what do you do when you get home? So these, it turned out, were very, according to folks in the community who we spoke with afterwards, this was very, very important to them, for them to know. All right, so I think you guys get the gist of the booklet. We also know that we have a large number of young families in Clarkston. That's the community we were in. And at this time, there was very little known about how to deal with young children. Again, we used the CDC index to measure kind of what, did we get the statements right? Did we get the placement right? And what we realized from a parent's perspective is that they wanted answers to their questions. So, so the headings of each of these is a question. It was also important for the parents that instead of using animated graphical images, that we use pictures of people and children who look like themselves. In this one, because we just really didn't know a lot, we did address the kind of what we don't know yet, right? So we didn't know at that point if children with other health problems would get sicker from COVID. So we used that principle as well. How will I know if someone has COVID-19 if they don't have symptoms? Well, you won't. And that's what, you know, and again, here's the direction. This is why you need to stay 6 feet away from people, right? Here's an explanation of what to do. Okay. Let's see. We also did we took that flip book, that printed flip book, and we made it into an animated flip book, and we made it into a YouTube video. Anybody with a cell phone, even if you don't have internet, can access a YouTube video if you have cell service. So we also spread it around that way, which was really helpful for lots of organizations like faith-based organizations who have huge lists of people, but who they couldn't reach with anything printed. Okay. The last thing that we did, as the vaccine started becoming available and as misinformation and disinformation and fear became a reality, we worked with our clinical partners in the community to describe for people that they should get a COVID vaccine, and here's why. What was really fun about doing this is done using a tool called Vyond, V like in Victor, Y-O-N-D. You use animated characters, but you can change the characters so that they're culturally appropriate for your audience. And then you can, of course, do voiceovers in whatever language it is that's appropriate. Which is a really important health literate principle, right? Is to reach the people in a way that's meaningful to them so that they can understand and access and use the information. I'm going to show you the English one, our little English video. And then I'll just show you some of the other ones that we created. Oy. Hang on. Okay.
You should get a COVID vaccine. Here's why.
Hi, this is the doctor's office. How can I help you?
Hello, I wanted to know about the COVID vaccine. Should I take it?
Let me get the doctor for you. He can tell you more about the COVID-19 vaccine.
Hi, this is the doctor. I'm glad you're calling to find out about the COVID vaccine. The vaccine is very safe and can help you from getting sick with COVID-19. There's no reason to be afraid of getting the vaccine. Millions of people around the world have gotten the vaccine with very few side effects. You can't get COVID-19 from the vaccine. It works really well and helps your body fight the virus.
Thanks, doctor. I understand now how important it is to get the vaccine to protect myself and my family.
So let's just talk for just a second about why that may or may not fall into the Healthy People 2030 health literacy guidelines or objectives. So we want to think about moving people toward participatory decision-making in healthcare, right? Having conversations with your caregivers, asking questions. These 1-minute videos don't do that. It's a clinical talking head talking to the patient. On the other hand, what we know about many of these communities is that that is how they want to receive their health information. Because of social and cultural issues, they're not likely to, and language issues, they're not likely to stop a physician or a nurse or someone that they perceive to be in a powerful position and say, well, I'm not sure I understand that, or could you please explain that to me again? And so we learned from prior research on the ground that having a clinical talking head, giving clear, plain, simple information in plain language was the right way to address these communities. Let me just show you the Arabic version of this, just so you can see kind of how we were able to make these changes.
يجب أن تحصل على لقاح كوفيد. هذا هو السبب.
مرحبا، هنا مكتب الطبيب، كيف يمكنني مساعدتك؟ مرحبا، أود أن أعرف أكثر عن لقاح كوفيد. هل يجب علي أخذه؟ دعيني أحضر الطبيب لك وهو سوف يخبرك أكثر عن لقاح كوفيد.
مرحبا، أنا الطبيب. سعيد لأنك تتواصلين معنا لمعرفة المزيد عن لقاح كوفيد. اللقاح آمن جدا.
Okay, so you get the idea, right? Different cultural characters that are appropriate. I learned so much about these different cultures. For example, I just assumed, which is a bad thing to do, that everybody who was an Arabic speaker, that the women should all have a hijab on, should all have a head covering on. As it turns out, Kurdish women do not wear one. And so when we redid the Kurdish video, you had to use different female characters than for the other Arabic speaking. It's fascinating. It was a great process. And I encourage all of you, if you have the opportunity to work with communities who are very different than you and yours, that you do that. It's a great opportunity to learn things. Okay, I think I'm going to stop sharing now. There we go. And we've got a few minutes for questions, comments. I'm going to open up the chat.
Iris, someone did ask if they were going to be able to get a copy of your presentation.
Sure. So, I'm very happy to do that. I'll send it to Karen and she can post it. Right. As you can see, my slides are very brief and then I just do a lot of talking to them, but I'm very happy to send that to you, and I'll include my notes on my slides. I'll also include the URLs to the Adult Literacy Research Center and to the Prevention Research Center, so that you can access any of those documents if or use any of the COVID-19 related documents that we've made or videos that we've made.
I'm not seeing any questions in the chat, but if anybody wants to open up their mic or ask, we can do that.
Karen, this is Michelle. If I could just say something very quickly.
Sure.
After I stopped sharing, I was able to see the chat box, and I saw that Jamie Watson, who I think has left the call, asked a question about the numbers in the material that we practiced scoring. She mentioned things like 6 feet and 60%. And so she asked, why didn't we use part C? And those numbers totally slipped by me. So even though Jamie's not on, I wanted to thank her for pointing out that that there were numbers in that, and we should have used part C. Unfortunately, we didn't have time to go through part C and part D, but our user guide will walk you through those parts as well. So thank you, Amy, and thank you, Jamie and Abstentia.
Sure.
And I actually, Karen, I'm going to not give you the task of having to share my share my presentation. I think I can just put it on here. No, I can't. Sorry.
That's okay.
I
I don't mind
the
sending
file?
it out to them.
Okay.
We could do that.
Okay.
I am so excited to have both of you with us today. It was some great tools and presentation, and as always, such a meaningful conversation. Just thank you both so much for kicking off our health literacy session. This is wonderful.
It was a pleasure. Very happy to be here. And Michelle, as always, very happy to be working with you.
Thank you, Iris. Same here.
All right. Well, and you guys are right on time with with today, so that's awesome. All right. Thank you, everyone.